Boom. Hey guys, what's going on? Welcome. Dr. Dan here, joining you guys again. It's always a pleasure to join you folks. I know it's been a while since I've posted. I try and keep this stuff more regular, but we just might as well jump right into it, okay? So, I wanted to touch on a topic today. I think it's very important given current news that's going on internationally with the imminent invasion of Ukraine by Russia. I just want to talk about the idea of hope. I don't want to get too political here, but the idea of this came up just given the current news. Today being March 1st, 2022, this invasion has been going on for about a week now. So I want to switch from unsettling news and move into my just area of expertise, which is medical cannabis and its potential for just giving patients hope, and the idea of the importance of the physician giving hope to the patient who really might be at the end of their rope. Okay. So I want to talk about a specific patient population who is either very new to cannabis or they've been unsure about the potential of cannabis actually being able to address their symptoms and increase their quality of life. Okay. So this particular patient, this is probably not the typical patient that I'll see who has some experience with cannabis and they're already very thumbs up and very happy and excited about the prospect of getting a legal cannabis card for making a purchase at the dispensary. Okay. This is a different patient. This is probably a newer patient with very little cannabis exposure, and they probably went a more traditional route in terms of prescriptive medications for their symptoms, be it for physical pain, arthritis, be it rheumatoid arthritis, osteoarthritis, or some sort of inflammatory arthritis, or for something like muscular pain, like, for example, back spasms or cervical spine spasms in our neck muscles, that sort of thing. And they might have tried a lot of traditional therapies, and for whatever reason, they didn't want to go the cannabis route, which is understandable for a lot of patients. I don't really look down on patients who have reservations regarding cannabis, because cannabis has always been, at least in our recent times, it's always been shrouded in controversy. A lot of different things have been said, regarding cannabis, and questioning its safety, questioning its actual utility for being able to address a lot of these symptoms that cannabis is prescribed for. So that sort of thing is understandable. And I think so that patient is really, really at the end of their rope. They didn't want to try cannabis as a first course, and they've tried these other more traditional medicines, and they end up landing on cannabis as a last resort, not a first resort. So this patient probably had a lot more stigma in their mind, coming into this, and that's why they saved cannabis as a real last resort. Okay, which is certainly understandable. People want to mitigate their risk, and cannabis had been touted as being highly risky, dangerous. This is your brain on drugs, that sort of thing. So that patient, I can absolutely 100% respect the patient who is just trying to be careful, and they don't want to do something that they don't know whether or not is safe or harmful. Okay, so with those patients, I want to be extremely sensitive and not over push any sort of personal bias that I might have, or even professional bias that's based in scientific fact, as close as we know it. I always say scientific fact in quotes, folks, because scientific fact is a really loaded sort of phrase. So I say scientific fact with the connotation that this is our evidence the best as we know it. All right, this is our best peer-reviewed evidence. Okay, so that's what I refer to as a scientific fact in quotes. So getting back to these patients might not be privy to the information that I'm privy to regarding cannabis's, is that a word? Cannabis's safety and its efficacy. All right, these patients have gone through a whole lot, and they've probably gone through a lot of internal turmoil in their mind as to their social implications of having a cannabis card. So I tread super, super lightly with these patients, because ultimately what I want to give them is hope. And that's what I really want to talk about today, because hope is super important. The kind of feeling that patients walk out of the clinic with is super, super important. All right. They might be walking in with a lot of negative feelings regarding stigma of cannabis, and if them taking the risk, this in their minds, the social or health risk of trying cannabis, they're wondering if it's actually worth the buck, if they're going to get the bang for the buck. All right. Which is valid. And I think it's important for physicians, if they're in this sort of position, I think it's important to validate those feelings and address any negative feelings towards cannabis that the patient might have, the risks and benefits. Every new patient, we give them this handout here, in which really what we seek to do is just educate patients on the different kinds of cannabis products, the risks and benefits, how to use cannabis safely. I think people would want to look at this more than my face. And just a little aside about the authors. This is Dr. Steve. He's my partner. He's a really, really great doctor. Tons of cannabis experience on him. Terrible picture there of me. My smile looks all weird. I'm like, silly looking smile, ugly smile, but whatever. The main thing for me, in order to allay patients' fears and really, really get them on the road to feeling good about what it is that they've chose to do, is to educate them. All right. Knowledge is power, folks, be it medical cannabis or investing. All right. And to touch on that point, as a real good segue, any treatment that you do, be it alternative medicine or traditional medicine, folks, this is an investment in your future. The whole goal is to get quality of life years. That's always my goal with all of my patients, be it in this clinic or in the primary care clinic. All right. My real focus, folks, outside of cannabis medicine is longevity medicine, lifestyle medicine, the choices we make. All right. Eat this, don't eat that. Drink this, don't drink that. Exercise, don't exercise, always exercise, assuming you're not hurt. But taking the dive into cannabis can be frightening for some. Okay, I think a lot of people who are, I guess, pro-medical cannabis already coming into it, they might discount the feelings of some who are justifiably scared or apprehensive for whatever reason. And I think it's important to win those patients who might be really, really, really on the fence as to, am I doing the right thing? Does this doctor really, really know what he's talking about? Is he invested in my health and future? Or is he just trying to score the buck, get me in and get me out? Okay, that's a very valid reason. That's a very valid thing for patients to think or feel. And I think doctors should be aware of that and really have it in their minds to educate patients and give them some sort of roadmap so that they feel empowered that making this decision to go in this particular treatment route is going to lead to a good outcome. That's giving the patient hope. Okay, that's the really, really important thing. And what I try and do in order to give patients hope is really just give them a means of how to use this cannabis most to their benefit and the least to their detriment. Okay, I really want to outline the risks and benefits and the different kinds of cannabis products that are available to them so that they can know moving forward, hey, this can actually do something for me. A lot of patients coming into this might not be aware that there are non-smokable options. Okay, a lot of people might have come into this and thought, okay, well, all I can do is Cheech and Chong it up and I have to smoke something. I'm a non-smoker. I don't like the idea of smoking anything to relieve my symptoms. Well, great, perfect. You might not have known that there are good sublingual cannabis oils that can be taken that are of good enough potency that can address your symptoms without inducing overwhelming psychoactivity. That's hope to a lot of patients. Someone who might have muscular pain, physical pain, osteoarthritis, PTSD. They might just have trouble going to sleep or addressing their symptoms to get them off to sleep. And they just might need a tool to get them there. So they might have been apprehensive about the idea of cannabis strictly because it was smokable. And now they have hope because they have an option. And what was in the middle there was information and education. That's how we give patients hope. Physicians, this is really, a lot of this is really directed towards you, but I think it's important for patients to see this part of the intake aspect and taking a good history and really just tailoring, our treatment modality to that patient specifically. So the idea of non-smokable stuff, that's super important. Patient might have COPD, or they just otherwise might not want to inhale. All right, so that's important. The how to dose and not hit a patient with so much overwhelming psychoactivity that they're functionally impaired. Okay, a lot of patients are wanting to treat pain, but in going in there through their day-to-day stuff, they can't handle the idea of being just functionally impaired and too high to go about their daily. Well, what's in the middle there again is information, proper dosing, mindful dosing. Okay. I like to start patients off on, if possible, a microdose, either microdosing a tincture or an edible if they're going the non-inhaled route, starting at something like 2.5 milligrams of THC or 5 milligrams of THC, just to get them started so they can familiarize themselves with the aspect of psychoactivity. All right. That can be frightening for some people who have never gone down that road. So I think once you give them the information of how much to take, you can have the patient feel comfortable and they can trust this process a little bit more, because they know on the front end that they're not going to be taking a deep dive into the deep end. They can start in the shallow end and titrate the cannabinoid dose up to something that they can manage. Once a patient can manage something all on their own, you have a patient who feels immensely empowered, right? And that's a really, really important thing. And I think that's an important advantage that you get with cannabis that you don't get with traditional medicines. You see, if you prescribe a medication, for example, a muscle relaxer, people have tension in their lower back. One of the most common diagnoses is this thing called lumbago, lumbar back pain. Real super common diagnosis. We see it day in, day out, lower back pain in the lumbar sacral area from patients lifting, bending. It could be just something through normal wear and tear. Someone overweight, they might just have too much weight in their anterior abdomen, big old beer belly. And what's happening is they have to use the fulcrum of their lower back to keep themselves standing upright, despite having a whole lot of weight, a whole lot of poundage on their front side. So the stress is going to come in the form of their lower back. So they might be prescribed a muscle relaxant like tizanidine or cyclobenzaprine. We call these Flexeril, things, Xanaflex, things along those lines. So the thing is, patients don't know a whole lot about these weird named things. They have to take it in the prescribed amount that their doctor recommends. And for the most part, they don't know the biochemical interactions that might happen with these chemicals or the long-term effects. Okay, so they're stuck taking this thing that they don't really, really know. Okay, whereas cannabis, it's a natural product. The toxicity is very low. The patients can titrate it themselves to effect. So they don't need to call the doctor and be like, can I go up, down, this, that, blah, blah, blah. When you have a product that can address symptoms and the patient can titrate it themselves and they can figure out their own dosing, that's hugely empowering. That's an advantage that you don't get with traditional medicines. All right. That gives patients hope. All right. That's an important thing to touch on. And it's a really important thing to give patients, because when they walk out the door knowing that this can take care of their symptoms just as well in some cases as something that the doctor prescribes, they are now the doctor. All right. At least for that thing. Okay. And patients being able to doctor themselves gives them a sense of independence. And that gives them hope that they can manage whatever is going on and go on with their lives and feel happy about their lives. So I think that's something that's really important to touch on with regards to cannabis. I think it opens the door for not just cannabis being used as an alternative therapy, but opening the door for other things where patients can manage themselves with non-chemical, non-pharmacopoeia chemicalization, okay? Pill type medication. Because ultimately in the long run, we want to keep that pill count as low as possible. All right, because these are unnatural medications. Oftentimes they end up with decremental benefit, meaning you take it for a while and then it stops working or it didn't work in the first place, which is the case for a lot of medications, especially things like SSRIs. These are serotonin reuptake inhibitors that we prescribe for depression and various other things. So, at the end of the day, cannabis at least gives patients one more avenue that's safe and sustainable and can help them feel better about their day-to-day presently. They don't have to wait for it to start working. They can enjoy today. All right, that's hopeful. But getting a patient to that point where they can trust the physician and feel like what the physician is saying with regards to medical cannabis is good and workable and true, that's where the work comes in. And that's what I strive to do. And really what's in the middle there, folks, again, is information and educating the patient. So patients, whether it's medical cannabis or some other thing, some other treatment that you're starting with your physician, the most important thing that's in the middle is the discussion about the risks and benefits and how long we're going to be taking a particular medication and what we can expect and what are some of the pitfalls that can come with it. So that's, just to give you a little insight when I talk to patients, those are the kinds of things that I touch on. Where might cannabis fall short? Where can it really help? Once patients are aware of the reality of what sort of thing they're looking at, they feel a whole lot better. They just want the doctor to tell them the truth, right? Is this actually going to help? For the most part, cannabis will help for a lot of things. Sometimes it won't. But I think once we can get patients in the realm of reality, they're going to feel a whole lot better about themselves. They're going to feel a whole lot better about controlling their destiny and being in the driver's seat of their happiness and getting quality of life because they're able to treat their symptoms with something natural and something they can control. All right. That gives patients hope. So, that's really all I wanted to talk about today. I guess I ramble on more than I planned on, but who cares? That's really pretty much it, guys. I don't want to go more than I should. I do want to touch on, the good citizens of Ukraine. I hope that all works out fine. It's a terribly worrisome situation. I try and stay off my political high horse and not get into stuff that's above my pay grade. But, in terms of giving hope, I'm really hopeful for them. And I hope it really works out well for them. I'm going to stay in my doctor's seat, not my politics seat, but my thoughts and well wishes really go out to those citizens of Ukraine. It's really a troubling time right now. I hope everyone just stays safe. To my patients, everyone here on our homeland, I hope you guys stay safe. I hope you guys stay hopeful, and I wish you all the best, okay? One love. Dr. Dan, I'm out. Till next time, guys. Bye.